You're with 104.8. We're Channel 4, hit music for the UAE. Thanks for hanging out. It's Eve. All right, on the show, we have a very special guest. We like helping you out with your health. Health should be number one. So, invited Dr. Dev Roy from NMC, Royal Hospital Sharjah, to tell us more about our nose problems, our snoring problems. In case you're suffering from this, he might be able to help. Hi, doctor. So, can you tell us what is snoring and sleep apnea?
Snoring is usually a loud sound that is produced in the nose and throat when someone is sleeping. And this is because the air is flowing through the nose and throat. And during snoring, sometimes the patient stops breathing, and this is called sleep apnea.
Okay, and can you tell us what causes snoring?
There are many causes. One is the anatomy, that is the structure of the mouth and nose. If there is any obstruction, there could be snoring. The other causes are if the patient is very obese, taken alcohol at night, certain positions while sleeping.
So what are the symptoms then?
One of the symptoms is snoring. That is, snoring could be a simple snoring or it could be associated with sleep apnea. Usually the patient comes when the partner is complaining. But what we doctors are trying to identify is the breathing being affected. Then the patient will have daytime sleepiness. So when they are at work, they will feel sleepy.
When do you need to then seek a doctor and get some advice?
Whenever the snoring is very loud or you are having daytime sleepiness, that means while you are driving, you feel sleepy. When you're sitting in a lecture or in a room and you suddenly feel sleepy, this is the time that you should see a doctor.
Sure. And what are the treatments that are possibilities for this?
We need to make a diagnosis with a nasal endoscopy, and there is a test called as sleep studies. Initially non-surgical, which involves weight loss to avoid alcohol at night, and sometimes we do nasal treatment, that is treatment of the nose. And we advise patients to sleep on the side. Medical treatment involves there's a machine called a CPAP machine, which you have to wear a mask and air is given at a certain pressure to keep the airway open so that there is no snoring and no pressure on the heart and lungs. There is also surgery for some cases where we do surgery for snoring.
And finally, what will happen if we do not treat this?
There is a lot of pressure on the heart and lungs and symptoms of pulmonary hypertension, or there can be also heart failure. You may fall asleep while driving, and that can give rise to a lot of accidents.
You've been amazing. Thank you so much, doctor, for coming on Channel 4 and educating us this weekend.
Thank you.